In this lecture, I will give a quick review for the permanent mandibular incisors. As you all know, we have 4 mandibular incisors, 2 central on each side of the midline, and distal to each central incisor, we have a lateral incisor. Like all other anterior teeth, mandibular incisors develop from 4 developmental lobes, 3 labial, which are represented by the 3 mamelons found on the incisal edges of the newly erupted incisors, and 1 lingual lobe gives rise to the cingulum. As you can see, the central and lateral incisors have similar form and they share similar function. Just like the maxillary incisors, they are used for cutting, slicing, and incising food material during mastication. We have common characteristic features that are unique to the permanent mandibular incisors, so they are termed arch traits. That's to say, they differentiate the mandibular incisors from maxillary incisors. First, they have a smaller mesodistal dimension than any of the other teeth in the dental arches. As you can see in this figure, the mesodistal dimension both of the crown and root is narrower than the maxillary incisors, than canines, premolars, and molars. Also, the shape of mandibular incisors is quite uniform and more symmetrical, as you can see in this figure, compared to other teeth. This mainly applies from the mandibular central more than to the lateral central. Another feature is that their contact areas are usually located in the incisal third, very close to the incisal edges. And the mesial and distal contact area of the central incisor, mandibular central incisors, are usually at the same level, facing each other mesially and distally. Another feature concerning their lingual surfaces or anatomical landmarks of the lingual surfaces is that they have usually a smaller and less marked cingulum, very shallow lingual fossae, ill-developed mesial and distal marginal ridges. So these are features that differentiate them from the maxillary incisors and canines. Also, the incisal ridges of the mandibular incisors are usually located lingual to the long axis of the root. This is the long axis, and you can see that the incisal edge is lingual to the long axis, which is the reverse of the situation of our maxillary incisors, where they are located labial or at the long axis of the root. Also, mandibular incisors show labial inclination of the incisal edges, while the maxillary incisors show lingual inclination of their incisal edges. This configuration helps to establish normal occlusal relationships between the maxillary and mandibular teeth. They have a single conical root, which is narrow mesodistally, as depicted in this figure. However, their roots, both the central and lateral, are wide mesodistally, and they have a broad developmental depression, as you can see here, extending on most of the root length for both the mesial and distal aspects. Finally, the mandibular incisors show uniform development with a few instances of malformations or anomalies. Now moving to the permanent mandibular central incisor. The characteristic traits of this tooth, or the type traits that differentiate this tooth from all other teeth in the dental arches, is first, the mandibular central is the smallest tooth in the dental arches. As you can see here, its mesodistal diameter is a little more than half the mesodistal diameter of maxillary central. As you remember, the mesodistal diameter of maxillary central incisor is 8.5, while that for the mandibular central is 5 millimeters only. The crown and roots are wider labiolingually than they are mesodistally. Usually, the labiolingual diameter of the mandibular central incisor is only 1 millimeter less than that of maxillary central. The outlines and surfaces are regular and bilaterally symmetrical, as it's obvious here. Usually the line angles are sharp. It has sharp line angles. So both the mesiodistal and mesioincisal and distoincisal line angles are sharp, especially the mesioincisal line angle. Since it's considered the smallest tooth in the dental arches, the mandibular central incisor is the only tooth which has only one antagonist, which is the maxillary central. So it occludes with one tooth only, which is the maxillary central. All other teeth in the dental arches occlude with two opposing teeth in the opposite arch. For example, the mandibular lateral occludes with both maxillary central and maxillary lateral. Maxillary lateral incisor occludes with both mandibular lateral and mandibular canine, and so on. Also, we forgot to say that the mandibular central incisor is considered the first exogenous tooth. That's to say, it's the first permanent tooth to replace primary teeth. Although molars, maxillary and mandibular first molars, are the first teeth to erupt into the oral cavity, but they are not considered succedaneous teeth because they do not replace a primary tooth. Concerning the labial and lingual aspects of the mandibular central incisor, usually, as we said, the crown is symmetrical bilaterally with a uniform shape. The mesioincisal and distoincisal line angles are sharp. The incisal edge is straight and at right angle to the long axis of the tooth, as you can see here. Both the mesial, this is the mesial and distal contact areas are located in the cervical third, very close to the incisal edge, and they are at the same level mesially and distally, opposing each other. The root usually is straight line, continuing from the cervical line downward. Then in the apical third, it will end in a distal curvature. From the lingual aspect, usually the mandibular central incisor have the same outlines and position of contact areas. All are the same as was discussed for the labial aspect. The only difference is that the lingual anatomical landmark are less developed or less marked than those of the maxillary incisors. So we have a smaller cingulum, which is more cervically located and is centered with the long axis of the tooth. We have a very shallow lingual fossa, ill-defined mesial and distal marginal ridges. Also, the position of the cervical line lingually is 0.5 millimeter more apically located compared with the position of the cervical line from the labial aspect. So the crown length from the lingual aspect is 0.5 millimeter more than the crown length from the labial aspect. Also, as a feature for all other teeth, there is lingual convergence of the crown and root, so the mesodistal dimensions of the crown and root are narrower lingually than those from the labial aspect. Moving to the mesial and distal aspects of the mandibular central incisor. Usually, the crests of curvature, both labially and lingually, are located, just like our other incisors, located in the cervical or cervical third, close to the or just coronal to the cervical line. You can see here that how the location of the cervical line is more apical in the lingual aspect than on the labial aspect. So we have different levels for the cervical line. Also, as we mentioned earlier, the location of the incisal edge is lingual to the long axis of the root, which will facilitate normal articulation with the maxillary incisors. the mandibular central incisor, also characterized by presence of developmental depression extending on most of the length of the root. The same features can be noticed for the distal aspect. However, the only difference is that the curvature of the cervical line is less, just like all other anterior teeth, is 1 millimeter less. Also, the incisal edge is lingual to the long axis of the tooth. We have also a developmental depression, but usually it's more marked. Sometimes we have a deep groove extending along the depth of this developmental depression. Moving to the incisal aspect of mandibular central, usually the outline of the crown is symmetrical, it's oval or diamond shape. The symmetry of the crown is very much illustrated in this aspect. So we have identical mesial and distal, this is the mesial, of course, mesial and distal halves of the crown. And since we have a lingual inclination of the incisal edge, we can see much more of the labial aspect than the lingual aspect. Another important characteristic is that the labiolingual dimension is always greater than the mesiodistal dimension. So here we have 5 millimeters and the labiolingual is 6 millimeters. So it's 1 millimeter greater than the mesiodistal dimension. Another characteristic feature is that the incisal edge is usually straight and bisected or located at the center of the tooth or center of the line that bisects the tooth labiolingually. This feature is very important in differentiating between the mandibular central incisor and lateral incisor. Moving to the permanent mandibular lateral incisor, we'll give a quick review for this tooth. The mandibular lateral resembles the mandibular central. However, we have certain differences between the teeth. First, the lateral incisor is somewhat larger than the mandibular central, about 0.5 millimeter larger in mesiodistal dimension, which is the reverse of the situation with the maxillary incisors where the lateral is smaller than the central. Regarding the labial and lingual aspects of this, usually the labial aspect shows the added fraction of 0.5 millimeter of mesiodistal dimension added to the distal half. Also, the crown is not as bilaterally symmetrical as that of the mandibular central incisor. The distal incisal angle is more rounded than that of the central incisor. Regarding lingual anatomy, also it's shallow and smooth, but the cingulum is located slightly distal to the long axis, and the root is usually longer by 1.5 millimeter than that of the central incisor. Also, the distal contact area is also located in cervical third, but it's more cervically located to contact properly with the canine. Regarding mesial and distal aspects, no much difference is noticed between mandibular central and lateral, except for size. Labiolingual dimension of the lateral incisor is 0.5 millimeter greater than that of the mandibular central. Also, we have developmental depression extending on most of the root length. The main difference is in the incisal aspect. As we can see, the crown is not as bilaterally symmetrical as that of the mandibular central incisor. The distal half is the distal half is larger than the mesial half. Also, the incisal edge is not a straight line. Usually it's an angle. It forms an angle with the line that bisects the crown labiolingually. So this is a characteristic feature for the mandibular lateral to accommodate with the curvature of the mandibular arch. Also, the cingulum can be noticed to be located slightly distal to the long axis of the crown.